I want to thank the organizers for inviting me to participate in this session. An outline of my presentation will be as follows. I'll provide a brief overview of peripheral artery function, specifically on large elastic artery stiffness and vascular endothelial function. Next, I'll talk about the aerobic and resistance exercise training effects on arterial stiffness and endothelial function, and discuss the modulatory influence of age and sex on modifying the benefits achieved with these exercise training regimens. Next, I'll go over the mechanisms underlying vascular adaptations to exercise and conclude with a summary and future directions. Large elastic arteries include those in the central circulation, such as the aorta and the carotid arteries. These large elastic arteries function to buffer the pulsatile pressure generated by cardiac contraction, which facilitates a continuous steady flow of blood to the periphery and target end organs. With aging and with other risk factors, these large elastic arteries can stiffen, leading to an increase in pulse pressure and flow pulsatility, damaging the microcirculation in these target organs. And indeed, large elastic artery stiffness has been linked to heart disease, macular degeneration, cognitive decline, and the development of Alzheimer's disease and related dementia and other kidney diseases. Large elastic artery stiffness can be assessed using the gold standard technique of carotid femoral pulse wave velocity. This measurement assesses the speed at which the pulse wave transfers from the carotid artery down to the femoral artery, with a faster pulse wave transfer indicative of increased arterial stiffness. Arterial stiffness can also be measured directly using carotid artery ultrasound, which measures the distension of the artery with systole to diastole while also measuring central blood pressure. Vascular endothelial function refers to the ability of the vascular endothelium to regulate blood flow and maintain vascular homeostasis. The vascular endothelium is a single layer of cells that line our blood vessel and serve as both a mechanical and biological barrier between the blood and the vascular wall. It can secrete a variety of molecules, including the pleiotropic molecule nitric oxide, which can promote vasodilation, promote an anti-inflammatory environment, and help in the blood coagulation process. Both traditional risk factors such as aging and high blood pressure and smoking, and non-traditional risk factors such as environmental stressors and physical inactivity and menopause in women can lead to the development of endothelial dysfunction, secondary to increased inflammation and oxidative stress. Endothelial dysfunction can lead to vascular remodeling, create a pro-inflammatory environment, a greater vasoconstrictor tone, and be prothrombotic, ultimately increasing cardiovascular and cerebrovascular events. Vascular endothelial function at the macrovascular level can be assessed using the gold standard technique of brachial artery flow media dilation. This involves ultrasound imaging of the brachial artery at rest and following a forearm cuff occlusion, which creates a ischemic stimulus that, upon cuff release, the increase in blood flow causes a shear stress across the vascular endothelium and stimulates nitric oxide synthase to produce nitric oxide from L-arginine. The nitric oxide then diffuses to the vascular smooth muscle cells to promote vasorelaxation. A healthy artery will have a large vasodilatory response. Endothelial function at the microvascular level can also be assessed using more invasive techniques by measuring the forearm blood flow response to pharmacological agents such as endothelial-dependent vasodilator acetylcholine. A recent meta-analysis of 12 studies examined the effects of habitual aerobic exercise on middle-aged and older adults. It specifically looked at studies that used the technique of pulse wave velocity. Overall, aerobic exercise had a favorable effect on modulating arterial stiffness. However, there was high heterogeneity as indicated by this I-squared of 84%. While I was in Dr. Douglas Seal's lab, we conducted a series of investigations to determine the effects of endurance exercise on large elastic artery stiffness in healthy adults. We measured carotid artery compliance using ultrasound in young sedentary individuals, older sedentary individuals, and a group of older endurance-trained master athletes. Men are in the gold bars and women are in the black bars. Overall, we show that arterial compliance is reduced in the groups of older adults. However, those adults that were highly endurance trained had higher arterial compliance compared to their age-matched sedentary peers. We next took the sedentary adults and had them undergo a 12-week moderate intensity exercise training intervention that involved primarily walking. Carotid artery compliance was assessed before, which are in the gold bars, and following this 12 weeks. And we compared them to groups of sedentary young individuals. In the men, we showed that this 12-week moderate intensity exercise program improved carotid artery compliance. Similarly, if we look at postmenopausal women who were chronically using hormone therapy, they were able to improve their arterial compliance and brought them up to levels observed in premenopausal women. Thus, these data would suggest that habitual endurance exercise can attenuate the age-associated reduction in large artery stiffening in older adults and can improve or even restore arterial compliance in previously sedentary older men and postmenopausal women chronically using hormone therapy. We also investigated the effects of regular resistance exercise on large elastic artery stiffness in healthy adult males. These studies were led by Dr. Moto Miyachi, who was doing a visiting professorship at the time. In a cross-sectional study, arterial compliance was measured in groups of sedentary and resistance-trained young and middle-aged adults. Overall, middle-aged adults had reduced arterial compliance. However, the middle-aged adults who participated in regular resistance training activities had the worst arterial compliance. In a follow-up study, Dr. Miyachi randomized healthy young males to an intervention group of resistance exercise training or a non-exercise control group. He demonstrated that arterial compliance was reduced after 2 months of exercise training, while at the same time beta stiffness index also increased. These levels were sustained out to month 4, and then he followed them during a detraining period, and they went back to baseline. Overall, these data would suggest that resistance exercise may have harmful effects on arterial stiffness. In a follow-up study, he conducted a meta-analysis and looked at the effects of resistance exercise training on arterial stiffness in young adults and middle-aged adults. Overall, resistance exercise training was associated with an increase in arterial stiffness, largely in the younger individuals. In a recent meta-analysis of 41 randomized controlled trials, the effects of aerobic exercise training versus control was examined on endothelial function, assessed using flow media dilation. This includes studies across the adult lifespan, had overall considerable heterogeneity in the magnitude of benefits. Age appeared to contribute to this heterogeneity, but even within the age groups of middle age and older here, there was considerable heterogeneity in the magnitude of benefits. Exercise intensity also contributed to the heterogeneity in responses, with a moderate intensity exercise training program having better responses or greater responses than vigorous. Low intensity exercise essentially had no effects. And then those individuals that had the worst endothelial function at baseline showed the largest improvements to the exercise training, whereas those who had normal endothelial function, defined as having an FMD greater than or equal to 7%, had no response. In studies conducted in Dr. Seal's lab investigating the effects of endurance exercise on endothelial function in older adults, demonstrates considerable heterogeneity in the vascular benefits that are observed with the exercise training. In this particular study here, brachial artery flow media dilation was measured before, which are in the gold bars, and after an 8-week moderate intensity brisk walking program. What they showed is that the older men demonstrated an improvement in flow media dilation, whereas there was no effect in the older women. They thought maybe that the older women might need a higher exercise training stimulus, maybe more vigorous exercise to demonstrate improvements. Thus, they conducted a cross-sectional study where they brought in age-matched groups of sedentary and highly endurance-trained master athletes. Similar to the exercise training study, the older men appeared to show the benefits from being exercise trained in that they had preserved endothelial function. In contrast, there was no difference between the sedentary and highly endurance trained, older women. Dr. Chris D'Souza investigated the effects of regular endurance exercise on microvascular endothelial function in older males. To do so, he measured the foreign blood flow response to acetylcholine in a group of young sedentary males, which are in the blue here, and in a group of older sedentary males, which are in the gray. The older sedentary males had reduced foreign blood flow response to the acetylcholine, indicating that they had impaired microvascular endothelial function. He also assessed the foreign blood flow response to acetylcholine in groups of young and older endurance trained. And in contrast to the sedentary groups, there was no difference in their foreign blood flow response between the young and older endurance trained, suggesting that the older endurance trained males had preserved endothelial function. Next, he took the older sedentary males and had them participate in a 12-week moderate intensity exercise training program involving primarily brisk walking. The foreign blood flow response to acetylcholine was measured before the training, which is going to be in the gray here, and then following the 12-week training program, which is going to be in the blue. These older males showed an improvement in their foreign blood flow response to acetylcholine, demonstrating that they can improve their microvascular endothelial function, and indeed brought them up to levels of those older males that had been training most of their life. Dr. Jessica Santos Parker investigated the effects of regular endurance exercise on the foreign blood flow response to acetylcholine in groups of postmenopausal women. They compared the foreign blood flow response to acetylcholine to premenopausal women who were sedentary and a group of postmenopausal women who were sedentary, and in a group of postmenopausal women that were endurance trained. The postmenopausal women had reduced foreign blood flow response to acetylcholine compared to premenopausal women. However, there is no difference between the postmenopausal groups. This is better demonstrated here, looking at the area under the curve. They also measured flow media dilation in these women and also showed reduced flow media dilation in the postmenopausal groups compared to premenopausal, but there was no difference between postmenopausal sedentary and those that were endurance trained. As these data would suggest, the habitual endurance exercise has beneficial effects on macro and microvascular endothelial function in older men, but not in postmenopausal women. The reasons for the heterogeneity in exercise training adaptations on the vascular endothelium between men and women are not completely understood. One potential reason could be related to sex differences in gonadal aging and sex hormone levels in older adults. And what I mean by that is, unlike women who all will go through menopause if they live long enough, men do not experience the female equivalency of menopause, and thus perhaps the older males have adequate circulating levels of testosterone to help them transduce the exercise training benefits. And in a study that we conducted that supports this, we examined the independent and combined effects of estradiol in endurance exercise training on endothelial function in postmenopausal women. We assessed flow media dilation before, which are going to be in the gold bars, and following randomization to either a placebo group or an oral or transdermal estradiol group. What we showed is that flow media dilation improved in the women treated with oral or transdermal estradiol for 3 months. There was no change in the women treated with placebo. This was consistent to what is observed in the literature. Next, we wanted to understand if whether they participate in exercise training then, if they could see an additive benefit on the vasculature. And so the women continued to take their assigned treatment, but then participated in a 12-week moderate intensity exercise training program. And what we found is that in the women who were treated with placebo, there was no improvement in flow media dilation with exercise training. In contrast, in the women that were treated with either oral or transdermal estradiol, we did observe an increase in flow media dilation. Thus, these data would suggest that estradiol recouples endothelial adaptations to endurance exercise training in postmenopausal women and suggests that circulating levels of estrogen may be important to transduce these exercise training stimuli. Next, I'll discuss mechanisms underlying vascular adaptations to exercise, particularly on the vascular endothelium. As I mentioned at the beginning of the talk, oxidative stress is a key mechanism contributing to the vascular endothelial dysfunction observed with aging as well as in those with risk factors. Thus, in this particular study, Dr. Skurza asked the question on whether or not the preserved endothelial function observed in older endurance-trained males is related to diminished oxidative stress. To do so, she measured flow media dilation in groups of older sedentary and age-matched older endurance-trained men and looked at the responses to a saline control condition followed by responses to a high-dose vitamin C infusion. What this high-dose vitamin C does is it acutely scavenges superoxide, removing the tonic suppression of nitric oxide and vascular function. What she showed is that in the older sedentary males who had reduced flow media dilation compared to the older endurance-trained males, they showed an improvement to the vitamin C and brought them up to levels near what is observed in the older trained males. In contrast, vitamin C infusion in these males elicited no additional improvement, suggesting that these men are not under tonic oxidative stress. In a subsequent study, they performed an endovascular biopsy of the brachial artery and looked at endothelial proteins of nitrotyrosine, which is an oxidative footprint, NADPH oxidase, which is a key source of reactive oxygen species, nuclear factor Kb, which is a potent transcriptin factor for inflammation, as well as mitochondrial superoxide dismutase in groups of young sedentary in the white, older sedentary males in the gray, and in an age-matched group of older endurance-trained men in the black here. What they showed is that the older sedentary males had higher levels of nitrotyrosine, NADPH oxidase, NFKB, and lower levels of endothelial superoxide dismutase compared to young sedentary and older exercise-trained males. There is no difference in these protein levels between the young sedentary and the older endurance-trained males, suggesting that the preserved endothelial function in endurance-trained older men is related to reduced endothelial oxidative stress, possibly related to enhanced or preserved antioxidant systems and stress response. When we looked at this particular question in our postmenopausal females, we did the vitamin C infusion and assessed flow media dilation during the saline control at baseline, which is going to be in the gold bars, and following high-dose vitamin C, which is in the hash bars. All women in the groups showed an improvement in flow media dilation, suggesting that they're under tonic oxidative stress. We also brought in a group of highly endurance-trained postmenopausal women, and during the saline condition, there was no difference in their flow media dilation response and the sedentary women. And when we infused vitamin C into them, they also showed an improvement, suggesting that these highly endurance-trained postmenopausal women are under tonic oxidative stress. We next then infused the saline and vitamin C following the 12-week endurance exercise training while they were taking placebo or oral or transdermal estradiol. In the placebo group, where I showed that they didn't show an improvement, when we infused vitamin C into them, they show an increase in flow media dilation, suggesting that these women are still under tonic oxidative stress. In contrast, in the women treated with oral or transdermal estradiol, where I showed that they demonstrated an improvement in endothelial function, infusing vitamin C into them demonstrated no further improvement, suggesting that they were no longer under tonic oxidative stress. Thus, these data would suggest that the diminished endothelial adaptations to endurance exercise in estrogen-deficient postmenopausal women may be related to reduced resistance to oxidative stress, and that estrogen may play a permissive role in endothelial adaptations to exercise training by increasing the resistance to oxidative damage by enhancing antioxidant defenses. To summarize, aerobic exercise and resistance exercise training has beneficial effects on arterial stiffness and vascular endothelial function. However, there is considerable heterogeneity in the magnitude of vascular benefits and may be dependent on the sex and age of the individual. To understand the factors that contribute to exercise response variation and vascular benefits, we are collecting data on intrinsic factors such as sex, race, ethnicity, age, and hormonal status, along with extrinsic factors including sleep quality, medications, health status, diet, and just daily physical activity, and taking a multi-omic approach to understand the exerkines that get released into circulation with an acute bout of exercise and how that adapts with a chronic exercise training program. And then we plan on leveraging the molecular transducers of Physical Activity Consortium, or the MORTAPAC study, and collect all this data and then use artificial intelligence and machine learning to try to explain exercise response variability, particularly between older men and women. With that, I thank you for your attention and look forward to addressing questions.